Hey there, should be here with Women of Community's Take 10, a series, each episode under 10 minutes, and elevates and celebrates a woman of color working for the health of her community. I am on TikTok, in case you have not noticed, and what you hear is one of the viral songs, and I'm sure you mainly think about TikTok in terms of viral music paired with some dance moves. But what if I told you you could leverage the platform for, wait for it, health education? And that's exactly what we're talking about today. Our guest today is Dr. Heather Irobunda. Heather is an OB-GYN for New York City Health and Hospital. She's also the medical director of Robyn. She started her career at Fort Drum, making sure that military women had access to high quality women's health. And she's also been a medical researcher for sexual health. At this point, you're probably wondering, what does all of this have to do with TikTok? Well, what if I told you Heather has over 27,000 followers on Instagram and over 30,000 followers on TikTok? And does she use her platform to sell anything? Nope. It's simply for an online community and health education. Let's bring up Heather now. 1 second. So excited for you to be here today, Heather. I love your content, and I'm gonna maybe fangirl a little bit during this interview, but thank you for taking the time to be here.
Well, thank you for having me.
Tell us more about the community that you support and how are you supporting your people?
Most specifically, I do try to address BIPOC women, especially women that look like me, women, people who identify as women, anyone who's felt like kind of like they didn't really know what was going on, because like I like to tell people, I didn't know how to track my period until I went to medical school. I didn't know how to do a lot of things. There's innovative ways that you can utilize social media to connect with your communities, connect with your patients, and you can use it as an adjunct. Something that I like to think about is that we have on average like 15 minutes with a patient, right? How am I going to teach somebody in 15 minutes? Okay, you have a problem with your period, but if you don't like understand what your period is, how am I going to teach you what a period is, what ovulation is, what different types of problems you can have? 15 minutes is not enough time for that. You can think of it as an adjunct, another piece of literature. This is another tool that I can use to expand my practice. At one point, a lot of us were like, don't Google, right? I Google, I Google everything. So I don't think it's fair to tell people that, but you have to tell people how to do it wisely.
So when we look at Instagram, TikTok, there are a lot of physicians already on these platforms. But what I love about your content is it's straight up health education. And there is a lot of misinformation on social media platforms in general, people who are not qualified sometimes giving advice on things. And so this is like one of the things that really struck me when I have been following your content. You're able to relate and engage with your communities and you like really support them. And so health education doesn't have to be dry and boring. And it's like that whole thing again of women of color working for the health of their communities that they're passionate about, show up and get it done. And now you have over 50,000 followers combined on TikTok and Instagram. That's insane.
Which is nuts.
Tell us about your story a little bit.
So, it really started as like my patients are trying to find information about something that's going on with them. And then they're like, oh, I went on, I saw this on Instagram. I Googled this, whatever. And all kinds of craziness comes up. And typically in medicine, we're like, you have your Sanjay Guptas of the world, who is a G, love Sanjay. But it's traditional media platforms. He's on CNN. Is my 16-year-old patient, is she watching Sanjay? Can she understand Sanjay? Does she identify with Sanjay? It's I feel like in general, our profession, it's just kind of that buttoned up. And this is what we're supposed to look like or dress like or sound like or be like, right? But our role models can look a lot of different ways. We don't all have to fit the same mold, right? And so that's what I wanted people to see, that, okay, like maybe you've never seen a doctor that looks like you, but people like you can be a doctor too. I was just looking for a way to make it relatable, right? I then kind of talked to a few people, found out like how to do this, and just I started off with my IG page and my blog. I was very opposed to TikTok initially because I was like, I don't think I know how to like do this. I learned how to do TikTok on YouTube. Literally put in the search how to TikTok. And I learned how to use TikTok. And I went for basics, turn the app on. And like, these are what the different things are. Like, I went through that. And then you have like the more intense ones. And like, I had no intention on really being forward facing either. Like, are people going to judge like how I look or what I weigh or like whatever? And so I think I got past that and was just like, you know what, whatever. Like, this is who I am. I face the world in my everyday like this. I mean, we're just expanding that to my online presence, I guess.
For people who are sort of naysayers of social media, healthcare can be a pretty traditional place in some settings. What do you tell them is the business case for doing this work?
This is the wave of the future. Like, this is where things are going. Like, you can either get on the train or you can be left. Just like, you know, you have to compete for a lot of things. It's like, you got to compete as a healthcare provider, a healthcare system. Where are people going? Where are people learning about things? Online, on social media. My inbox on Instagram, my DMs all day are asking me, where do you work? I want to schedule an appointment with you. This generates revenue, this generates business, this generates whatever you want it to.
You're a full-time doc at New York City Health and Hospital. You work for a public system. And I love that people are reaching out to you to see.
Yeah, and that's what's great about it, because a big part of what I want people to know is that just because it's a public hospital system, that doesn't mean that we're any worse, or the providers or the docs or whoever is there is any worse than someone in the private sector. A lot of us are trained by the same people. It's just a matter of how you see us. And I think that social media can definitely level that playing field.
So Women of Community is all about elevating and celebrating women of color working for the health of their communities. Are there any women of community you'd like to give a shout out to?
Dr. Tamika Cross is somebody who I think is a great follow. She's actually the OBGYN who was on that Delta flight. They didn't believe was a physician. And she started the whole like hashtag what a doctor looks like. Very educational stuff. And then there's Dr. Momin Nelson. She'll talk about certain GYN topics. And then she does like a teen talk thing with her daughter, Dr. Woodis, Tiffany Woodis. She does this like Mocha Moms, trying to like really address the Black maternal health issue. Oh, and then there's one other really good one too, which is the Black OBGYN project, which is actually a whole bunch of OBGYN residents.
Check out the comments and you'll see links to all of the folks that Heather just mentioned. Please do follow them. Last question, want to leave with an actionable item for folks. What's one thing people can do to help accelerate your work?
There is an act, the Black Maternal Health Omnibus Act, that is going through Congress, and it's all kinds of different things like, you know, increasing the amount of money we give to community-based organizations. There's even like narrowing the digital divide. So there's like things in there about Wi-Fi, creating data and digital platforms for education for these things. If there's anything that I can get you to do, it'd be calling your congressperson, emailing your congressperson, adding them on Instagram, which I like to do very often to my congresspeople, to let them know that I'm serious about this.
For folks watching, again, check out the comments for more information on that. And we would love your support in getting that passed. Heather, this has been amazing and this is so fun. And You have not disappointed in terms of you're exactly who you are in all content.
That's so funny. I always think it's like, I don't know what people are expecting, but I'm glad I live up to expectations.
You definitely do. Thank you again for your time. I really appreciate you.
No problem. Take care.